Community Living Windsor is once again doing its part to make a measurable difference abroad in Nicaragua for children with disabilities and their families, providing them with essential medical resources. A key goal of the project is to promote human rights and societal integration for people with disabilities. Gerard Phillips is a manager of support for Community Living Windsor, who recently returned from a group mission trip down to Nicaragua, and he reports on the strides being made. Okay, Gerard, I understand that you recently returned from Nicaragua as part of the mission for Capacita on behalf of Community Living Windsor. So can you tell me a little bit about your experience down there?
Sure. We arrived to a very welcoming community in Nicaragua, and one of the things I managed to do was visit the 4 projects that we currently support for children with disabilities. One clinic at the hospital where we saw about 16 patients that first Monday and met with the families, just got of hearing their stories and seeing what the work that we're doing, what it means for them. And then we managed to take a trip out to 3 of the outlying areas close to the Honduran border, where we also provide clinics on a monthly basis for a number of people there with or children with disabilities. One of the things that really impressed me was the sense of community that the people in Nicaragua bring to each other. They rely on each other for many of the things that they do. One particular story that comes to mind is this young lady with disabilities. She's about 27, and she's currently still involved in the school system as a student in one of the classes that's integrated with people with disabilities. It's a class probably about 30 students with one teacher. And when she finishes her day program at the school, which is probably about 2 o'clock in the afternoon, she goes around to the community and does errands for a lot of the people, the businesses, and for individuals. So she has no verbal skills. So a lot of her communication is done with signs or gestures. And she manages to communicate so well that way. Plus it's a smaller community. So she does have the support of the people in that area to help her achieve some of the things that she wants to do, to achieve in life, some of her own dreams. So I was very impressed by that. We also visited a young man who's probably about 18, and he has cerebral palsy. He was born with cerebral palsy, and he's not able to get around. He's sort of bedridden, but he lives in a home with his mom, who's his primary caregiver. But in the yard that they live, it's the mom, her parents, her siblings. They all live in the same area and in the same household, really. And the mom works full time for the city in that area, but they support her, by providing child care and respite care, that type of thing. So it's all sorts of a community event that goes on in this one area. And then there's another lady who sort of coordinates one of the projects that we have, and she runs a business, her own business, as well as having a child with a disability. And she runs a bakery where she bakes about 1,000 loaves of bread every day, and she sells it. So it's part of her income. But she uses part of her income to support a lot of people in that area. Once a year in January, she makes about 400 backpacks for the kids, and she includes papers, pens, clips, whatever a kid might need for school. So it shows the need in the area. But it also shows that there are people who are willing to sacrifice from whatever they have to give to the other as well. This particular person, she while we were there, one of the people we had supported in the past, his mom, who needed some support as well, had passed away. And the night they came to let us know that the person had passed away, and they said, we've been to the bakery, and she gave us $500. She gave us about $1,000 worth of food stuff. Bread, that type of thing, so they can run their week that night. So I think the sense of community is so important. There is a lot that could be done. We raise, 20,000 US a year to help support the projects. That's, for us, that may look like a lot. It's not a lot, and there's a lot more work that needs to be done.
It could be done, yeah.
But, we're just one agency doing something, and I think that by doing that something, it makes a difference. And we heard that day after day from the actual people who are part of the project that gets something from us, that is saying, the work that you do here, the money that you raise, it really helps us. We would like more money to go into like education and that type of thing, but what you raise right now is doing a lot for the people who are getting that support from us.
Very well. Can you also tell me about your own sense of gratitude being involved in the project yourself? And can you tell me about the 4 projects you're currently working on, just a little bit more of where the money goes on behalf of the organization?
Well, for me, the gratitude, one of the things I'm grateful of is that I was able to go as part of the team from Community Living Windsor. I have been working with the project for the last 6 years on the steering committee as part of the organization committee for the actual fundraiser that we have, which is a state dinner towards the end of September every year, the Chicago Club. And so it gave me that chance to see the money I help raise, what's happening, where it goes, how it's used, how it's managed, and sort of the end results then of the money that we raise. The 4 projects, the one is in Managua, which is the capital of Nicaragua, and we run that out of the main hospital in Managua. There's also a children's component to it. However, part of the things we're doing is for anti-convulsive medication. One of the things we want to spend some time with is sort of seeing what is the history of disabilities or people who have seizures in these areas. Is it their surroundings? Is it their water? Is it their lifestyle? So it's part of that sort of getting to know a little bit, and there's a lot more research that needs to be done. Unfortunately, they don't have the areas for those research, to happen.
The facilities.
They don't have facilities in Nicaragua for such things to happen. If they do need to do like genetic testing, for instance, there's no genetic testing lab in Nicaragua. They'll have to go to somewhere like Miami or North America or something like that. So that's sort of a need that we really cannot sustain right now. We can't afford to build a genetic lab that costs millions and millions of dollars. So it's unfortunate, but the little bit we do in the clinics, because it helps. It pays for the children to receive the medication. And in the other 3 areas, in El Jicaro, Canwapa, and Ocotal, we run very similar clinics in those areas. One of the things that I noticed is that a lot of younger people are having children, and by having children, they're not getting the proper nutrition or prenatal care that is needed before you have kids. So I think that education in that regards will be helpful, and if we have to expand, then we should expand into providing more support dollars for education, so that people have a little bit more sense of what they're doing for nutrition, for prenatal care, and for that sort of thing. I think will be great, will be helpful if we can get involved in doing that.
Well, I thank you for your time and certainly for your efforts abroad and for joining me today.
Thank you. It's my pleasure.
I'm Kevin McShan for Community Living Windsor.